A report carried out by Afrobarometer and NOIPolls show that trust-related issues drive vaccine hesitancy, as many Nigerians do not trust the government to ensure that the vaccine is safe. The Executive Director, NOIPolls, Chike Wago, spoke at an event in Abuja on COVID-19. Let's take a listen.
Again, remember from the previous slide that blue represent those that are already vaccinated, green those that are likely to get vaccinated, and red those that are unlikely to get vaccinated. You can see that trust in government's ability to ensure vaccine safety is a huge driver for those that are not likely to get vaccinated. You can see from the slide that 83% of those that do not trust the government at all to ensure that the vaccine is safe, 83% of them are unlikely to get the vaccine. So if there's a way that we can improve on people's ability to trust that the government will make sure that the vaccine is safe, that might be something that will push people towards getting vaccinated. Government response to COVID. 56% of Nigerians say that the government has done fairly well or very well in managing the response to the pandemic. But majority say that they're not satisfied with the government's effort to ensure that disruptions in children's education are held to a minimum and to ensure that health facilities are adequately resourced to deal with the pandemic. 7 in 10, 71% expressed dissatisfaction with the government's effort in providing pandemic-related assistance to vulnerable households. Next slide. So the question here was, how well or badly would you say that the current government has managed the response to COVID-19 pandemic? 56% said fairly well to very well, so that's a pass mark. But when it comes to how satisfied people were with government's response to COVID-19 with regards to, one, ensuring that disruptions to children's education is kept to a minimum, 61% were not satisfied at all. The key takeaways is that 89%, that is 9 in 10 Nigerians, report that their household did not receive COVID-19 relief assistance from the government. 8 in 10 Nigerians say that the distribution of COVID-19 relief was somewhat unfair or very unfair. A large majority, 83% of Nigerians, say they believe that some or a lot of the resources intended for the COVID-19 response has been lost to corruption. Only 2% of the people that we spoke to think that none of these resources have been embezzled. Access to COVID-19 relief. So the question is, since the start of COVID-19 pandemic, have you or your household received any assistance from government like food, cash payments, relief from bill payments, or other assistance that you were not receiving before the pandemic? Only 12% said that they received any assistance. So we have 89% of people that didn't receive anything. Again, when it came to education, even though there might not be so much difference, you see that there isn't any, in terms of education, it didn't really reflect, as now I would have expected to see people with low education get more relief than others. The only place that we have significant difference was in age. So for those 56 years and above, 18% of them said that they got some relief materials. Next slide. Was COVID-19 relief assistance distributed fairly? Only 17% believed it was somewhat unfair or very fairly distributed. On perceived pandemic-related corruption, the question was, considering all the funds and resources that were available to the government for combating and responding to the COVID-19 pandemic, how much do you think was lost or stolen due to corruption? You can see from the color schematic, 54% said a lot, 29% some, 9% a little. 47% feel that the government is somewhat prepared or very prepared for future health emergencies, but 41% feel that we're not prepared. So we still have a lot to do. Next slide. So this is a question on asking if the government should invest more to prepare for future health emergencies. So 61% agree or strongly agree that the government needs to invest more to prepare for future health emergencies. Only 32% disagree or strongly disagree that they should do so.
What have we done a little differently, or to concretize implementation, especially at the grassroots in communities where we have hesitancy? One of the things is getting the language directly to the people in the language they understand, and in smaller groups, to be able to have that discussion, if possible, at the compound level, at the community level, stakeholder meeting, town hall meetings, where people can ask questions and not necessarily rely on what they hear from radio and television. Because when they hear from radio and television, they can't ask radio and television questions. So people need that one-on-one touch.